Hey everybody, it's Dr. Yola with an update on COVID-19. One of the areas I want us to discuss is social distancing and why it's so important. So just recently, it was recommended that each of us practice what's called social distancing. It's allowing no less than 6 feet of space between ourselves and the person in front of us or the person behind us to decrease our risk of acquiring COVID-19. And this is based on two really important issues. The first is that a study was just released last week demonstrating that COVID-19 lives in air for up to 3 to 4 hours. Now, that doesn't mean that it's aerosolized, meaning that it can travel through the air via air ducts and vents. That's a completely different risk. And we have not yet known COVID-19 to be transmitted in that way. But what we do know is that COVID-19 can live in air once a person has sneezed or coughed in that space. What we also know is that COVID-19 can travel 3 to 6 feet when someone coughs or sneezes, which is why we recommend no less than 6 feet of space in front or behind us. So in the likelihood that someone coughs or sneezes and has had a COVID-19 infection, that we do not put ourselves at risk. The challenge, though, is that how will we know that when we walk into a space, whether or not the person who may have sneezed or coughed and had COVID-19, we won't know to distance ourselves because that airspace is there and we are at risk, which is why there has been the recommendation that we really hunker down and stay at home. There's a reason why Dr. Fauci, a world-renowned infectious disease doctor, is on the media telling us to stay at home as much as we can, because we cannot anticipate who is in the space coughing, sneezing, and releasing COVID-19. As we've talked about before, up to 80% of patients who have COVID-19 infection only have mild symptoms. So they may not know that they are infected. And as you guys likely know, we're still dealing with a lot of issues with testing. So a good number of people still have not been tested to confirm whether or not they have the infection. For all of those reasons, if at minimum you protect yourself by incorporating social distancing, but if you can stay at home, if you don't have to go to work, if there isn't a reason that compels you to leave your home, at least for right now, it certainly decreases your risk of acquiring the infection. It also diminishes the risk of us developing a steep peak in terms of the rate of cases. What we're trying to do is what's called flatten the curve. It's that double curve that you're seeing in a lot of folks' social media feeds. We're looking at the epidemic curve, or now the pandemic curve, but specifically here in the United States, we're looking at the epidemic as it currently exists. And it's good to pay attention to what's happened thus far. In Washington State, back in January, around January 21st, we had our first case. One case. Now, less than 2 months later, we have close to 3,000 people who are infected with COVID-19. And if we change nothing, if we continue to engage with each other, interact with each other, do not follow the recommendations of public health professionals, it has been estimated that 100 million people here in the United States will be infected with COVID-19 by May. The challenge with a rapid rise of cases, where on the graph that you're looking at, the y-axis is the number of cases, the x-axis is the amount of time. When we see a significant rate of rise, that can overwhelm our healthcare system. There are only so many patients that we as healthcare professionals can take care of, and there's only so much space in which patients can effectively and efficiently be cared for. So what we're trying to do is what's called flatten the curve. So instead of there being a peak, fast rise in the number of cases, it's a slow and steady amount of cases. As we've talked about before, anytime a novel or new virus appears, you're going to have widespread infection with large numbers of people affected. What we're trying to do as public health professionals and healthcare professionals is slow down the number of people who are infected with COVID-19 so that it does not overwhelm our current healthcare system. So that's why it's important to practice the measures that we've discussed. Now let's talk about a couple of the myths that are still out there. One in particular. We addressed it before in terms of a Japanese scientist saying that if we drink water every 15 minutes, that will decrease our risk of acquiring coronavirus 19 if we are exposed. Now what I'm seeing is that there are special waters that can be purchased, that gargling with salt water or Listerine, once exposed, can diminish your risk of COVID-19. And I can tell you again that that is not correct. We know that COVID-19 is transmitted through respiratory droplets via the eyes, the nose, and the mouth. And as an example, if by chance I touch a surface with respiratory droplets that contain COVID-19 and then I touch my eyes, the virus can be transmitted through what are called our nasolacrimal ducts. Gargling with salt water or Listerine isn't going to decrease that. There aren't antiviral properties in salt water or Listerine that are going to be able to kill virus and decrease your risk of getting the infection. So again, you want to make sure that you vet the information that you're receiving before you, one, share it, and two, certainly before you make any purchases. Now let's talk about some of the concerns about treatment that we're seeing out in, particularly in mainstream media, and I've seen it being posted on a couple of people's social media posts. There have been concerns about what we call non-steroidal anti-inflammatory drugs, NSAIDs, drugs like ibuprofen and Aleve, and concerns about using those for people who have COVID-19 infections. Now, even before COVID-19, we as clinicians knew that the use of certain NSAIDs can actually suppress your immune system. It's one of the reasons why for parents who see me after their little ones have received vaccines that I recommend the use of Tylenol as opposed to ibuprofen if they develop fever, because we don't want to affect the body's ability to develop an immune response when given a vaccine. That's the same case with COVID-19. We don't want to do anything that's going to suppress the immune system and the body's ability to fight off the infection. So right now, the recommendation as it currently stands, and again, these things are changing day by day, but for right now, what we do recommend is that you make sure that you do have some Tylenol, also known as acetaminophen, in the likelihood that you develop a COVID-19 infection and need to take medication or give your child medication for fever. The other concern that I'm seeing in the media is about blood pressure medications, and that people who have significant COVID-19 infections, that these medications are actually worsening the infection. And that is true, but it's for people who are having significant COVID-19 infections, those who are in the hospital. ACE inhibitors and angiotensin receptor inhibitors were attempted to be used to help treat some of the complications resulting from significant COVID-19 infections. That does not mean that if you have hypertension, also known as high blood pressure, and do not have a COVID-19 infection, that you stop taking your blood pressure medication. This is specifically for patients with significant COVID-19 infections who are having secondary complications, where doctors were attempting to use those two medications to help in terms of some of the blood pressure issues that were being observed with significantly ill patients. So I want to make sure that people with hypertension know this is not the time to stop your blood pressure medications. If you have any concerns, make sure that you reach out to your healthcare professionals. The other concern that I've seen pushed out in social media is transmission, and we touched upon that a little bit when we talked about social distancing. One of the questions that I actually got asked today was, Dr. Hancock, are you sure that this isn't being transmitted through aerosolized methods? There was a report out in Chinese media that they suspected that it was transmitted through aerosolized droplets, but they retracted that story. They backtracked and said that they were not certain. Again, these things are changing day by day, but based on studies here in the United States, what was demonstrated was that the COVID-19 virus can exist in air for up to 3 to 4 hours. It can exist on cardboard for up to 24 hours and can exist on metal, particularly steel, and plastic for up to 3 to 4 days. So clearly another reason to support why we should practice good hygiene, why we should make sure that we are coughing and sneezing in the crease, making sure that we're washing our hands so that we don't make contact with cardboard, with steel, and with plastic to put other people at risk. I know again that it is a scary time, but again, it's not time to panic. In my medical opinion, I always tell folks it's never time to panic. In my house, rule number 1 is don't panic. There's a lot of information coming out at us every single day. It's hard to understand and know what's correct, what's accurate. And it's one of the reasons why I try to post as often as I can to try to decipher what's going on, to give you as evidence-based information as I can. Again, it's important for each of us to take personal responsibility to protect everybody else. When recommendations are made to avoid crowds, our governor here in Maryland passed a law that said that no more than 250 people could congregate. Folks in Massachusetts, now their governor has passed a law that says no more than 25 can congregate. It's important to follow those recommendations. We're not doing this out of paranoia. We're not doing this out of panic, but it truly is to protect each of us and to not overwhelm our healthcare system with a rapid rise of cases. We see what's happening in Italy. One of the main reasons why we're seeing that is because their health system is overwhelmed. There are more patients than healthcare providers in space to appropriately treat them. And we do not want to have that same scenario transpire here in the United States. It's up to each and every one of us to take on personal responsibility to protect everybody else. So I call on each and every one of us to make sure that we're following the recommendations of our public health professionals, not only to protect ourselves, to protect each other. With each of my videos, I push out the fact that we need to be each of our brothers and sisters keepers, following the recommendations of our public health professionals. Taking these things seriously is part of that charge. I know that each of us will be able to do it. We'll be able to get through this pandemic together, but it will require the effort of every single one of us. As I hear more information, I'll definitely share it. Dr. Yola out.